Hello everyone, this is Praveen Kumar Tuppad from Vasco da Gama, Goa. I'm a practicing periodontist and implantologist. Today I'm here to educate the people about something called as aligners. Very few people are having adequate knowledge about aligners, and with through various means they hear about aligners, but the exact information about aligners is still not clear. So basically aligners are kind of transparent trays which are made up of food grade plastic. The material is called as PMMA, polymethyl methacrylate. Now these trays are put in the patient's mouth and it has to be worn for at least 22 hours per day. So in the remaining 2 hours, patient have the time to remove it, brush his or her teeth and have the food, and remaining time patient has to wear it. Next, we'll discuss some of the advantages of using the aligners. First and foremost is that it is removable. So patient has the freedom to easily remove the aligner, brush his teeth, and then have food also, and then put it back. So minimum of 22 hours of wearing is mandatory. And this becomes important when patient is having any kind of interview or any kind of marriage proposals or any kind of important function in the family. In such cases patients can easily remove it and put it immediately after the function is over. The second advantage of using aligners is that uh, it since it is removable, you can easily maintain, you can reach every corner of your mouth and brush your teeth properly, unlike metal brackets wherein it's very difficult to clean around the metal wires also. The third advantage of this is that in aligner treatment patient can visualize the treatment before only. Okay, we'll just show you a small video wherein a planning of the patient is done before actual start of the treatment. So basically you will come to know that what position of teeth you have right now and what you're going to get at the end of treatment. So for every patient we make a small video wherein a patient can see the treatment results before actually opting for it. So this is done in the beginning of the treatment. So here is the video of a patient whose upper and lower impressions are taken. So this is the impression of the upper arch and the lower arch. Upper and lower arch together. So we can see that there are orange colored buttons on the teeth surface, which are actually teeth colored buttons in the patient's mouth. Now this is a video of the upper arch where you can see that the front teeth are moving backward. So this is the final position of the teeth which we are going to attain at the end of treatment. Next important advantage of aligners is that the number of visits to the dentist is minimal. So suppose a patient will not be able to visit the dentist in the next 3 months. So all the aligners can be taken by the patients in advance for the next 3 months and directly visit after 3 months. So it does not mean that doctor should not see the patient throughout the time, unless there's nothing you can do about it. But it is good to see the patient every 2 to 3 months at least, to see the progress of treatment, whether our treatment is actually working or we are on track or not. So the last and most important advantage of aligners from patient's point of view is the pain part. The metal brackets can cause a lot of pain, ulcerations in the mouth, which is not seen in case of aligners. Now, which are the cases which can be treated using aligners? As per my experience, most of the simple cases can be done. That when I say simple, it means that only the teeth position can be altered. There will be many patients whose problem is not with the teeth. Their problem is that their jaw itself is not in the proper position. And so in such cases, if there is bone overgrowth or if the jaw itself is overgrown, in such cases aligners will not be possible. For those cases, some surgical procedure need to be done. So the next part of the video is about how to use and how to store the aligners. Okay, so as I said, 22 hours per day is needed. The patient will be provided some more accessories like chewy sticks and hooks, retrieval hooks, which will be used for placing as well as removal of the aligners. uh, how to store the aligner is to just, after you remove it, you just have to wash it in plain water with some soap, and then put it in the container which is provided to you. And this container is very small, so it's easily, you can put it in your pockets. So this type of container is provided along with the aligners, and here you can see a sample of aligner against a red colored background. So we can see that it's a totally transparent type of material. So I hope this short video helped people to understand the advantages of using aligners. Of if anything which I've missed out, if anything, any queries is there from any of the viewer, they can personally drop into our clinic, or they can comment in the comment box.